Hi everyone, I hope you will enjoy this presentation. The language of anatomy is universally accepted that enables precise communication between anatomists and healthcare professionals or healthcare providers. Objectives. At the end of this presentation, you must be able to define anatomy and have a precise knowledge about its types. The first and old definition of anatomy is that it is a science that deals with various basic structures of the human body. Another definition, which is an update definition for the old one, that it is the setting. Human anatomy is the setting of the human body in which the events of life happened, which means function. Types of anatomy, few words, few explanation about the types or terms that are used for types of anatomy. First of all is a living anatomy. The first type is a living anatomy that deals with a living body. The second type is morbid anatomy that deals with a dead body. The third one is the functional anatomy, that's a steady anatomy in relation to function. Fourth one is radiological anatomy that study the anatomy of the human body by using devices and tools such as X-ray, MRI, CT scan, etc. Fifth one is surface anatomy, which provides a knowledge of what lies under the skin. It is part of regional anatomy and for exploring palpable structure. Palpable means by using hands. Regional anatomy, other name is topographic anatomy, which means studying or dividing the human body structures by regions. Regions means major parts or segments, such as, for example, abdominal region, neck region, face region, axillary region, etc. Applied anatomy, other name is clinical anatomy, which is any tool or procedure that serves the clinical practice or the medical field. Neuroanatomy, another specialized type of anatomy that deals with nervous tissue or nervous system. Few notes about your textbooks that are given to you freely by your college, which is the Snell. As you can see, clinical anatomy of Snell, which is suitable for medical students, healthcare professionals, etc. It studies the human body by regions. As you could see in this picture, clinical anatomy by regions. Another edition, clinical neuroanatomy, also by Snell. And now I'm going to talk about a few notes about living anatomy that deals with living individuals and study their anatomy. This is done by 4 tools, and these are used by your seniors at internists or surgeons. We have 4 tools to study the anatomy of the human body. The first thing is the inspection. Inspection means by using eyes only. Palpation by using hands. Auscultation, it means by using a stethoscope, listening to the sounds. Percussion means listening by knocking the various organs and tissue of the human body. As you could see in this picture, the physician inspect the region which he wants. I think he is examining the thyroid gland, neck region. This picture show you palpation. As you could see, your physician using his hands to palpate the neck. In this picture, you could see auscultation by using stethoscope. This picture is for percussion. As you can see, the physician knocking the region which he wants to examine. He is suspecting pleural effusion, that is to say a fluid in the pleural cavity. So he wants to be sure before sending the patient to radiological anatomy or x-ray. So he's listening or knocking sounds. This is not important to you. This example is for specialized people only. Inspecting the thyroid gland, and this inspecting the neck region for thyroid gland also. Few notes about regional anatomy. Regional anatomy is studying, it is our study, by the way, it is our study. Regional anatomy by Snell. This type of anatomy, studying anatomy of the human body by dividing the human body into regions. The main regions of the human body are the head, neck, trunk, paired upper and lower limbs. Further subdivisions for the trunk is the thorax. The trunk area is the area of the human body which lies between the neck and the lower limb. So further subdivisions for this area is the thorax, abdomen, back, pelvis, and perineum. Each one of these areas could be subdivided into several subdivisions. For example, the upper limb could be subdivided into upper arm, which means brachium, or lower arm, which means antebrachium. Other examples is the eye region, which is called orbital region, neck region, face region, inguinal region, etc. In this picture, you could see the subdivisions of the abdomen into 9 subdivisions called right hypochondrial region, epigastric region, left hypochondrial, umbilical hypogastric, etc. And also, if you want to be a good diagnostician and reach to the final diagnosis of your patient, you must know that all these types of anatomy may be intermingled by one patient. Suppose you receive a patient after a car accident, so you must inspect him at first, palpating the sites of injury and sending him for further radiological exam by X-ray, ultrasound, etc. So, the tools or types of anatomy used in this situation is living anatomy, surface anatomy, radiological anatomy, and the clinical anatomy. The 3 main approaches for studying anatomy are regional anatomy, systemic anatomy, clinical anatomy. Regional anatomy is our topic. Systemic anatomy, it divides the human body into systems. These are respiratory system, gastrointestinal system, integumentary system, endocrine, musculoskeletal, etc. Circulatory system could be further subdivided into cardiovascular and lymphatic system. And at the end, I would like to say that modern anatomy is a functional anatomy. So our study of anatomy in this term will be functional human gross anatomy. Maybe this is a new word for you, gross. Gross means macroscopic anatomy with unaided eye. And the reverse of this is microscopic anatomy. That is to say, studying anatomy by aided eye, microscope, and other devices. This is the end of our topic today.